Alrighty, I'm going to go ahead and get started. Thank you everyone for joining. This is the next in the Advancing Resiliency series. Thank you again to Elizabeth Andrews and Ross Weaver for helping put this together for the past few months. This is sponsored by the Berkeley Group, where we are very thankful for their support. I will leave it to Elizabeth to do introductions. However, I just wanted to note that the CM credit is listed here. For the webinar. If you have any questions, feel free to direct message me using the chat feature. This is our APA Virginia chapter website where you can keep up to date with conference information and any upcoming or past webinar information. We really do encourage questions, but to help our moderators keep track and panelists keep track of everything, please just use the Q&A box versus the chat box to pose your questions, or you can use the raise hand feature to request to be unmuted during Q&A portions. But with that, I will pass it over to Elizabeth, and thank you all for joining.
Well, thank you, Jillian. And I'm Elizabeth Andrews. I direct the Coastal Policy Center at William & Mary Law School. And this is a series, as Jillian said, of lunchtime webinars that we've been arranging in partnership with Wetlands Watch. Thank you, Ross. This is our 6th one, I believe, and we're going to do one more after this. And today we're excited to have with us some representatives of the Virginia Department of Health to give us some updates on what they're doing in their regulations and programs to address climate change. Carrie Atwood is the Director of the Legal Services Division for the Office of Environmental Health at the Virginia Department of Health. She assists the agency in enforcement and compliance matters, as well as drafting regulations and policy. She has practiced public health law for over 15 years with both the Office of the Attorney General and the Virginia Department of Health. She is a member of the Virginia Wastewater Infrastructure Work Group, the Environmental Health Equity Initiative, as well as the VDH Climate Change Committee. Carrie graduated from James Madison University and the University of Richmond School of Law. She currently resides in Roanoke, Virginia with her family and serves on the Roanoke City Planning Commission. Lance Gregory is the Director for the Division of On-Site Water and Wastewater Services for the Virginia Department of Health. His division works with Virginia's 35 health districts and industry stakeholders to develop and implement regulations related to on-site sewage systems, alternative discharging systems, private wells, and marinas. Lance has worked in a variety of positions within VDH's on-site sewage and water programs at the local, district, and central office level, providing a useful perspective of the program's impacts at an individual, community, and statewide level. Lance is a graduate of Radford University and a Virginia Natural Resources Leadership Institute alumnus. And both of them, we really appreciate you joining us, particularly during the legislative session when things are so busy. So with that, I'm going to hand it to Carrie. Thank you.
Good afternoon, everybody. Thank you so much for having us. We are delighted to be here today to talk to you about some issues that we've been working on for quite a while now. Lance and I have definitely been working on these for at least 5 to 6 years at this point. We'll be taking turns handing off back and forth during the presentation. And I'm going to start by giving you a background of what the current climate looks like for Virginia private well systems and on-site wastewater systems in the Commonwealth. So we can advance to the next slide, Lance. Okay, great. There are approximately 8.5 million people residing in the state of Virginia, and there are approximately 1.1 million on-site septic systems serving the Commonwealth. There are more than 700,000 private wells as well. Septic systems have a finite lifespan, with most systems lasting between 30 to 40 years before having to be repaired or replaced. Based on US Census data and then the Virginia Department of Health data, we know that nearly 50% of all septic systems in Virginia are 40 years old or older. So we know that there are many hundreds of thousands of systems reaching the end of their lifespan or already in need of repair. There are also numerous households throughout the Commonwealth that do not have proper sewage disposal for their plumbing. They have illegal systems, straight pipes, or they lack indoor plumbing altogether. A report by the Rural Community Assistance Project titled Still Living with the Basics in the 21st Century highlighted that these issues disproportionately impact African-American households in Virginia. The report found that African-American households accounted for over 40% of all households in the state that lacked indoor plumbing. However, African-Americans make up only 20% of Virginia's population. Additionally, many property owners in rural coastal Virginia are seeing the impacts of climate change on their septic systems, with more frequent and persistent flooding in low-lying areas. This flooding can also impact the private wells located in these areas. And while private well construction has been regulated in Virginia since 1990, there are no ongoing water quality requirements for these wells after they are constructed and approved for use. There is only a single bacteriological sample required prior to placing the well into operation. The Virginia Cooperative Extension's Virginia Household Water Quality Program does provide private well testing to interested citizens on a voluntary basis throughout the Commonwealth. According to their 2019 annual report, over 40% of the private wells tested exceeded the safe levels of total coliform bacteria, and significant percentages of tested wells exceeded safe levels of pH, sodium, copper, lead, and E. coli. While there are many caveats to this data, number one, this was a voluntary sample taken by those who were interested, and number two, the samples were collected by the owners themselves. It does show a significant need for improved drinking water sources for many Virginians served by private wells. Next slide. Sea level rise can exacerbate the problems present in many communities. Many of Virginia's coastal communities have a moderate to high level risk for sea level rise, with many of these communities largely reliant on on-site septic systems and private wells. Recurrent flooding due to sea level rise can cause septic system failure by exposing systems in the low-lying areas to surface water flooding or inundation from rising groundwater levels, both of which can impede or completely stop the treatment process. Drain fields rely on unsaturated soil for proper physical and biochemical treatment of wastewater. When sea level rises, salt water from the ocean intrudes into groundwater reservoirs. The salt water then displaces the less dense, lighter freshwater, causing the groundwater to rise into the soil profile above, limiting the amount of unsaturated soil beneath the drain field. Heavy precipitation events associated with climate change add to the problem of a rising groundwater table. Increased water percolation into the soil from above refills or recharges the groundwater table, resulting in even higher levels. Now, what you see on the slide is a good example of what we're seeing in the field. On your right is a validly issued on-site septic permit. And you see that little orange dot at the top of the yellow drain field. That's the distal end of the drain field. And that was taken in 2002. And at that time, it met all of the requirements and regulations, including being over 70 feet away from shellfish waters. That same orange dot is now the yellow arrow that you see on the left-hand side. That picture was taken in 2019. In 17 years, the drain field has been completely submerged under the water. Next slide.
So to try and help us get a better handle on the issue that Carrie talked about with these failing systems and how many systems do we have that are failing, where are they located, we started trying to put together an idea of how can we better identify that, because right now it's only the property owners that come to us with a repair permit that we know about. And so people that want to fix their system, that have the means, they'll come to us, they'll apply for their repair. But we also have a lot of folks that are dealing with these issues that don't have the means to repair it and aren't coming forward. So how can we better identify where those areas might be where we have those issues? And so to do that, we reached out to the Virginia Institute of Marine Science, and they've been a tremendous resource for us to help us put together a map of potentially hotspot areas for septic failures. So Dr. Molly Mitchell has really been leading that effort for them and has done a tremendous job. And if I can share a little bit closer view of the work that they've been doing. So this hotspot map was done for every locality east of I-95, and there's a lot of information on this page here, and I'll try and give a quick summary of it. So first, We provided 10 years of repair permit data, and Dr. Mitchell and her team looked at a temporal, so over time view of those repair permits, and then use that to find where you have like these dark red boxes here. So this is all 1 square kilometer boxes across the state. And so these dark red boxes are areas where through that 10-year time period, they had persistent failing systems, persistent repair permits coming in. You also have areas where you have this brighter red center. These are emerging hotspots, so areas where maybe the first 4 or 5 years, there weren't a lot of permits, but started to see more permits over time. And then you have others, sporadic hotspots and the like. One thing that VIMS did find was that model did end up focusing a lot of the hotspots within more populated areas. And so then they did another analysis, which you can see off here to the right, where they looked at not so much the volume, but the percentage of failures within a 1 square kilometer area. So there may only be 10 houses within this area here to the top right, this red outline box. But say 3 of those systems failed within that 10-year period. And so that's what they were calling a high density failure area. So a lot of failures compared to the percentage of houses within that area. And so that was a great way to identify hotspots in more rural areas as well. And then you can also see they also added a number of data layers, and one of those being sea level rise impacts, with the really dark blue shades here being areas that are within 3 feet of mean sea level as of 2020. The slightly lighter shade of blue is areas that would be within 3 feet by 2024. And then the lighter shade of blue are areas that would be within 3 feet by 2080, based on NOAA predictions. And so you can see that almost this entire box here is within that area that right now is being impacted during high tide events and impacts where you have these higher tides coming in.
Thanks, Lance. So some parts of rural coastal Virginia are within areas that VDH defines as wastewater islands. And actually, Lance and Dana Revis used to work for VDH, wrote a white paper on that and kind of coined the term. They are similar, very similar to food deserts, if you're familiar with that. These are areas where individuals and communities do not have access to affordable wastewater solutions that are protective of public health and the environment. Often homeowners within these wastewater islands are forced to utilize means other than connection to municipal sewer pipes to remove waste from their homes, such as septic systems or straight pipes. The problems associated with the use of straight pipes and failing septic systems are particularly salient in the context of rural impoverished communities. This is in large part because homeowners in these communities cannot afford to repair their systems. You can see on the slide that the cost to repair a system can be up to $40,000 or greater. And just to fix a regular on-site system, a basic, you don't have to have any engineered system, I think Lance was telling me it was like $18,000 to $20,000 currently. And these are expenses that homeowners don't currently think about or plan for. So when these the systems fail and these costs pop up, a lot of people cannot afford to fix their systems. And this presents an environmental justice issue, because under the Code of Virginia, they are to be fined for their inability to repair or replace their failing on-site systems. Common issues resulting from the use of the straight pipes and failing septic systems are further exacerbated by the recurrent flooding and the looming threat of sea level rise in many of the eastern communities. This raises not only water quality issues, but public health concerns, as flooded on-site systems can cause pollutants to enter the environment. In reality, VDH has rarely sought fines against homeowners, but we have had to work to get systems repaired when there's no funding to do so. Next slide. You're on mute, Lance.
Sorry about that. So to help us better identify these wastewater islands, so the mapping tool that VIMS put together with the hotspot maps was a great first step. But again, that relied on repair permit data, and that's only capturing where somebody has the means and they're coming in seeking a fix, or we've received a complaint. But we know there's a lot of areas out there that our local health department staff know are problem areas, and they can identify them, but we don't get permits from those areas. And so another great tool that VIMS put together for us was this ability for local health department staff to go in and create polygons around a community where they knew there were wastewater problems. And then they could answer a number of questions. You know, did they have privies? Did they have straight pipes? Is it failing systems? And then a lot of these areas, especially in Southwest Virginia, already have identified solutions, typically extension of public sewer, and maybe even plans in estimated cost. And so the local health department were also able to add in where those identified projects were, if it had kind of a shovel-ready project and what that cost would be. And we were able to identify over 75 communities through this tool with, I believe it was close to $50 million in what were deemed shovel-ready projects. And again, typically those are in Southwest Virginia, and typically areas where it would be a public sewer extension that would be needed to correct that issue.
So one of the reasons that project was so important and what Lance already alluded to, we only knew about failing systems when somebody sought a repair permit to fix their system. And the existing legal structure that we had in place in the Virginia Code section certainly didn't encourage owners to come to VDH with a failing system. VDH was forced to either take someone to criminal court for a failing sewage system, or try to seek civil penalty fees, or have a court order someone to fix a system that lacked the money to do so. VDH is charged with the protection of public health, and we had to work to make sure that the systems were repaired and replaced when we could, but we didn't have a complete set of tools in which to do so. And on top of that, we had nothing in our regulations to deal with the impacts of climate change for the design and placement of sewage systems. As we saw in the previous slide, we can have something that's totally compliant with our regulations today that could be underwater in 10 to 15 years. VDOT was already considering the effects of climate change in its transportation planning, and VDH needed the ability to do the same with wastewater and water infrastructure. And as you can see from the slide, the last point, prior to 2021, we had no consistent funding to assist owners with repair their systems or replacement. The only recourse was enforcement. We often sought community partners through a patchwork of resources to try to help people repair or replace their systems, but we had no dedicated source of funding on our own. However, in 2020, the General Assembly passed Senate Bill 1396, and that did several important things to address the issues we've talked about with environmental justice and climate change in wastewater systems. Some of the things that bill did was authorize a fund that VDH already had in place to use those money to assist owners with repair and replacement of their systems if they fell below the 200% of the federal poverty guidelines. Now, it wasn't a very large fund, but it was something that we could use. It directed the Board of Health to adopt regulations that included the consideration of the impacts of climate change on proposed treatment works, and Lance will talk about that a little bit further about our efforts with the stakeholder groups going forward right now. Established the Wastewater Infrastructure Policy Working Group, which included members of VDH, senior leadership of VDH, senior leadership of DEQ, and community and housing development, and some other partners as well, to get together and talk about what the current needs were for wastewater infrastructure and what funding was available to assist homeowners individually and communities across the board. And we had the Virginia Environmental Justice Act, which defined environmental justice for the first time in the code, which was the fair treatment and meaningful involvement of every person, regardless of race, color, national origin, income, faith, or disability, regarding the development, implementation, or enforcement of any environmental law or regulation. Next slide.
So that was a huge step for us with that legislation, and then it was quickly followed up by another huge step forward for us in being able to address these issues with impacted homeowners with failing septic systems and private wells. As Carrie mentioned, right now, or prior to the ARPA funding that I'm about to talk about, DEQ does have some dedicated funding that they would provide to local partners. And there are several local partners that for years have done a tremendous job using the funding from DEQ to help homeowners with septic repairs and pump outs. But generally, when funding was made available for septic repairs or private well repairs, there was some restriction with geography, either restricted to a watershed or a particular locality. And so it was really amazing for us in the end of 2021 when the General Assembly, as part of their ARPA funding bill, designated $11.5 million to VDH. So it was $5.75 million in FY22, and then another $5.75 million in FY23 and 24 for us to provide repairs for well and septic systems for households at or below 200% of the federal poverty guideline. And this was a statewide program. There was no restrictions on geography, which was huge for us. So the projects that we're covering under this ARPA program, failing septic systems, so both conventional and alternative systems. And if you have a failing system and also failing alternative discharges, we're also replacing straight pipes and pit privies. And so those all can be replaced either with a fully regulatory compliant conventional system, if that's possible, an alternative system if necessary. And then if public sewer is available, we can also connect to public sewer. With the private wells, we are replacing inadequate water supplies. So those are things like wells that were installed that predated our regulatory requirements. Our regulations didn't come into effect for wells until 1990. So there's a lot of wells that were installed without any regulations in effect. Also replacing things like springs and cisterns. And then in addition to that, making sure that the existing wells that we're replacing are being properly abandoned, so we don't have these unsealed bored wells that you hear about every now and then in the news. And so we've been really excited to be able to provide that option for funding to those homeowners in the Commonwealth. Our program directed $7.2 million to what we're calling direct projects, where the local health department is working directly with the local homeowners to get a project installed and in the ground. And then we have additional funding that was made available to local partners. So similar to what DEQ has done, providing funding to planning district commissions, local governments, nonprofits, providing money that way as well. Our goal was to ensure equitable distribution throughout the Commonwealth. And so we did that through looking at a number of different health factors and dispersing funding based on the health factors that we were looking at to each locality. So Southside and Southwest Virginia received a larger per capita distribution than, say, Northern Virginia. And again, for these direct projects, the homeowner would apply directly to VDH. Where possible, the health department would design the system. So the great thing about this 200% federal poverty guideline level that was set for the funding, if a homeowner qualified for the SWAP program, our septic and well assistance program, they would also qualify for VDH design services. If you're over 200%, you would have to go to the private sector. And they also would qualify for a fee waiver. So we're able to knock out three birds with one stone there. And then where we couldn't design the system, either because it would be if the system needed an alternative system, we would put those out to bid for a professional engineer or an on-site soil evaluator to design. And then once we have a permit in hand, then our swap team is engaging through our EVA state procurement system to put those projects out for bid, get a licensed contractor on board, and have them do the work directly on behalf of the homeowner. And then VDH reimburses the homeowner directly. So the idea is the owner comes in once and applies, and then we're handling the process from there. So our initial plan was we were going to only budget 4.2 million for these direct projects, and we wanted to have close to 5.5 million for the local partners, trying to build that capacity for local partners. Our plan was we would hire a program manager, which with the legislation that Carrie mentioned, we received funding for a wastewater infrastructure manager position, which is a full-time position at VDH. And if any of you have worked with DEQ's grant programs, you may know Nicole Sandberg. We were able to steal her away from DEQ, and she's been doing a tremendous job. Then we had planned by March, we would hire a swap team, so some regional coordinators to help with these applications. We would do a soft rollout, do some promotions of the program between July and December of last year. And then we thought from January of 2023 to December 2024, we'd be getting applications and starting installations, and then we'd finish all the projects up by June of 2025. So our time frame for the funding, we receive funding, we have to have all the money allocated by December 31st, 2024, and have it all spent by December 31st, 2026. With our previous experience in grant programs, we thought, this would be a reasonable time frame. It would take some time for the program to take off, and we wouldn't really start rolling until 2023. But then our expectations met reality. So we rolled out a soft rollout, what we thought was a soft rollout of the application in January of this year. We were able to hire on our wastewater infrastructure manager in February, and so that was great getting Nicole on board. We had our first installation of a sewer connection by the end of March, so pretty quickly. And by the end of May, we realized that we had greatly underestimated the need, or not necessarily the need, but how quickly people would find this program and come in. We hired our swap staff, our regional program staff, between April and June. And by July of this past year, we had to put up what we called a soft pause on the applications. It was basically letting people know we still had the funding, but you're at the back of the line. It might be a while before we get to your application. And then by September 2nd of 2022, we had to stop taking applications altogether because we had allocated what we believed to be up to $7.2 million in direct projects, on top of $1.8 million in local partner projects that we've received. And so we wanted to make sure that we didn't over allocate funding, that we can pay for all the programs that we have or all the projects that we have. So we stopped those applications. So our current status, we have, and I'm sorry, I should have updated this a little bit. We have 302 projects for 263 applications. We've actually had 81 of those installed as of last week. And then we had about 50 more under contract. Again, we estimate the total of those direct projects is going to be somewhere between 6.7 and $7.2 million. And then we anticipate the remainder of those projects that we've received to be installed and that funding expended by June 30th of 2023. So well ahead of our initial anticipated schedule. The local partner projects, we have issued our first agreements with Northern Neck Planning District Commission and Middle Peninsula Planning District Commission. So really excited that they've been able to kick those off. And then we have 4 additional contracts that we will be publicly announcing here pretty shortly. And so those will be additional great opportunities for homeowners to seek assistance. But I think, and overall, it just really spoke to the need that's out there, that without any advertising whatsoever, this program just took off like a rocket. And we expended essentially all of the funding. We do have some reserve that we hope we'll have remaining come the middle of this year that we'll be able to re-advertise. But we expended the vast majority of that 11.5 million, or allocated it within 7 or 8 months. And so this is a map just showing the distribution of those projects. We did have some denials where people would apply and they would do an income verification and determine that they were over the income requirements, but the ones in green are the ones that were installed. So we had a few more, since there's 77 on here. There's been 4 more that have been installed since then. The ones in red are the applications received, and then the yellow are the ones under contract. So hopefully you can see it was a very good distribution across the state, but there was a very large volume in the eastern part of the state. It actually exceeded what we had initially allocated. So there was certainly a lot of need in the eastern part of the state.
So we've talked about all the problems and we've talked about some of the solutions that have come our way, but where do we go from here? So we're going to continue to work with our stakeholder groups that we've formed for amending our regulations to capture climate change impacts. And Lance will go into a little bit more detail about that in a moment. And we're continuing to work with VIMS on the models. We can continue to identify impacted communities. And the private well program recently partnered with the CDC and the National Environmental Health Association, NEHA, through a cooperative grant to develop an online GIS community platform mapping tool that shares information on installed water and wastewater systems from VDH's database, along with information from VIMS, from FEMA, from the EPA, from resource protected areas. And we'll look at some of the screenshots of that tool here in a minute. You can see all the cool layers that you can put on it. We continue to assist owners with repairing failing septic or connect to sewer when feasible, when we have grant money, that is. We try to educate owners on maintenance and operation of their system so that when they do get a repaired system or a new system, they can operate it and maintain that system so it can last for the 30 to 40 years that it should last. We work with localities and areas of sea level rise to identify where at-risk properties are and where at-risk communities are, to perhaps come up with a community-based solution instead of individualized solutions. And we work towards compliance, finally, with all the tools in our toolkit. Instead of just enforcement, we can now assist homeowners with repairing and replacing their systems. Next slide, Lance. Okay, this next couple of slides are just me bragging and showboating on our GIS model that we did with the CDC grant that I just talked about. So here we took the information from Three Rivers Health District in Virginia and used the data that we had with NEHA to create this GIS mapping tool. And here we have the data selected to show on-site sewage systems. So those are the green dots on it, with an overlay of the EPA's environmental justice screen criteria for a wastewater discharge indicator. There's lots of layers that we can play with to look at different risk factors for communities, and this is just one of them. Lance, if you'll go to the next slide. Here, this screen capture has the layers of on-site sewage systems, the dots, once again, overlaid with the socioeconomic indicators and the EPA pollution sources, including lead paint, air toxics, cancer risks, Superfund proximity, wastewater discharge areas. We can use these maps to really help target resources and assist the homeowners who are most at risk and identify these wastewater islands that we were talking about. Next slide. And this is showing the on-site sewage systems, again, the green dots with 3 feet of sea level rise. And as you can see, the little dots, a lot of them are now floating in the Chesapeake Bay or right on the edge of floating in the Chesapeake Bay. And you can see from the screen capture that we could use sea level rise 1 foot, 2 foot, 3 foot. all kinds of just fun criteria to really play around with our data and help identify where we need to target funding in repairs. Next slide.
Yeah, now I'll just echo Carrie's crowing on our staff. So Scott Vogel and Megan Sinsman did an amazing job putting that mapping tool together, and we've already put it to use in a couple of different instances. So Carrie mentioned we are also going through a revision of our sewage handling disposal regulations, and we're doing an overhaul, a complete revision of those regulations because they've not been revised significantly. And since 2020, we did just get some fast track amendments approved, but they were very limited. And so as part of that, we created a subgroup to look at climate change impacts and how we might modify the regulations to address those impacts. And so we started by using a HACCP model, so a hazard analysis and control analysis model that we often use for our food programs, but it seemed like a great tool for analyzing the potential impacts of climate change on on-site systems. So you kind of walk through a process of conducting a hazard analysis of what are the hazards presented to on-site systems by climate change. What are the critical control points with that hazard? So separation distance, setback to seasonal groundwater, and then look at what could be some critical limits that you could set for adjusting or protecting systems based on those critical control points. Then what are some monitoring procedures that you can put into place? And then what are the corrective actions that you take when those monitoring procedures find an issue? And then how do you verify, trust but verify, make sure that those corrective actions and that monitoring is being done? And then how do you record keep and document all of these different steps? And so the stakeholder group met several times in 2020 and got a lot of really great feedback. And part of what came out of going through that analysis, a lot of it was kind of led us where we thought we were going to go initially, but I think it was good for us to work through that stepwise process. And a lot of the feedback was that we do have a pretty good framework in place as it stands now, with the different levels of systems and treatment that are available. So you start with your conventional system, which is just removing fats, oils, and greases and solids through a tank, septic tank, and having some anaerobic treatment of the effluent before it goes to a drain field. Then we also have TL2 and TL3 systems, which are have some kind of a treatment device on them that's going to reduce that effluent down to as low as 10 milligrams per liter BOD5 and total suspended solids. We also have systems with added disinfection. We also have a standard for direct dispersal of effluent to groundwater, which is the highest level of treatment that we allow. And then finally, we have pump and haul. And so a lot of what we talked about and the conclusions that we were working towards were that, if these systems are properly designed and thinking about not just where they are today in relation to surface water, but where they may be in 10 or 15 years, you could potentially address that future impact. So maybe you design a conventional system and you start off, all right, we're going to be as far as we can get from surface water. We're going to be 120 feet away, and then have some mechanism to follow up in the future. And then maybe when you get to a point that you're less than 70 feet from shellfish water, now maybe we can add treatment. So right now, all systems have to be 70 feet from shellfish water. So we would need some evaluation on what would be a appropriate setback distance for TL2 or TL3 if we were going to reduce that setback. But then again, you could continue with those systems, monitoring them if it got even closer to surface water or shellfish water, maybe adding disinfection or increasing your treatment to the direct dispersal standard. And then if you get to a point where the system is inundated, then there is an option for pump and haul, which many localities have that agreement with the health department. And so that could be a kind of a last resort option for some property owners. So we do need to do some further analysis and flesh out things like what would be the appropriate mechanisms for monitoring, and how long would those permits be for, as far as coming back and looking at them in the future. But I think we got a good foundation for the regulations through that work group. And so the next steps that we have, so we did have a periodic review of the sewage handling and disposal regulations to kind of kick off the overall effort to revise them. There were no comments received during the periodic review, but that's not terribly concerning or anything. I think we will get more involvement as we get into it. So we'll be providing a response to the periodic review here very shortly, and then quickly after that, providing a notice of intended regulatory action. Historically, what we've done is started working with stakeholders on language before we get to the NORA. That way we have a good idea of what we're actually going to do, what stakeholders want to see. And then also so that once that NORA stage is complete, we can move pretty quickly into actual proposed regulatory language. So the next step, as we post that NORA and start working through that, we'll be working and pulling those stakeholder groups back together and actually working through outlines for proposed revisions. So we'll continue to do our assessments and analysis of changes that need to happen. But hopefully by the end of this year, we'll be in a good place with some proposed revisions that we can submit as soon as, hopefully we'll be through the NORA process and hopefully into the proposed action process by the end of this year.
Here we have a list of just helpful links and sources if you're interested in what we talked about here today. That's a link to Senate Bill 1396 that we talked about, that kind of turned things around for us at the health department anyway, in assisting owners with the repair and placement of their systems. Waste, One Woman's Fight Against America's Dirty Secret by Catherine Coleman Flowers. It's a book that we recommend to everybody in our division, at Lance's division, read to understand how environmental justice impacts occur with on-site sewage systems. Catherine Coleman Flowers is from Lowndes County, Alabama, where they had wastewater islands. And from the wastewater islands, they started to see public health impacts, the re-emergence of diseases that we thought we haven't seen for over 100 years, like hookworm and tuberculosis and all kinds of fun stuff like that. Still Living Without the Basics in the 21st Century is the report I referenced up front, which talks about the members of our community in the state who are living without indoor plumbing and what that looks like in the state. There's our VIMS outreach extension. That's the mapping tool that they helped create. And the one below that is the VDH GIS mapping tool that we were bragging about earlier that Scott Ogle and Megan Sinsman put together on the private well program. Next slide. And that is the end of our presentation. Please feel free to reach out to us. That's my email there, carrie.atwood@vdh.virginia.gov. and lance.gregory@vdh.virginia.gov. And as much as I wish that were me kayaking on the river right there, it's not, but it is my favorite thing to do. So I am really invested in making sure Virginia's waterways remain clean and good for all recreational and public health uses. We'll be happy to take any questions that you have.
Great. Thanks so much, Carrie and Lance. That was super interesting, really good information. We do have a few questions in the chat box, so folks, feel free to keep adding those in, but we'll just start at the top of the list here. So one attendee referenced package plants, which are sewage treatment that occurs in modules to begin with and can be expanded. Notes that those are pretty helpful in rural communities, and hopefully as that technology evolves, it can become less expensive. So does the state research sort of emerging trends like that? And is there sort of a method to communicate information about new innovations, best practices, things like that?
In terms of new treatment devices, we do receive every year requests from manufacturers to approve new treatment devices. And so we have an internal process for how we review those. Typically, those treatment devices are going through NSF or a similar type of system to kind of show the efficacy of their system, because usually they want to be used in more than just the state of Virginia. That being said, there are, I know the Middle Peninsula Planning District Commission, they have a pilot program that they're looking at that's researching some systems or a system. So there are some different mechanisms out there to get systems researched in Virginia. We also have in our regulations a method for experimental systems to be installed. There's a lot of extra hoops that you would have to jump through to have one installed, but we do have, I feel like, a pretty open program to allow for innovation of different treatment devices in Virginia.
Excellent, thanks for that. Looks like we have another question, sort of thinking about managed retreat a little bit. Given that you were showing that many of the existing septic systems along the shoreline have or will soon be inundated by bay or ocean waters, and therefore not viable at that location, and there are no sewer systems available to connect, are you or any other state entities working with property owners to purchase properties so residents can relocate to more viable locations?
I can speak for VDH. We currently do not have that authority to do that. I don't know about other state agencies, whether that has been part of the solutions proposed. I know there's been a lot of resiliency work for the communities on the eastern side of the state to start thinking about managed retreat, but VDH has not been involved in that process at present. We don't have the authority to do so under the Code of Virginia.
And I'll just add, with the regulatory revision that we've talked about, so this topic did come up in that, and one of the important things for us is, we're looking at potential impacts. We want to be taking in mind what we think may happen in the future, but we won't know till we get there, right? Whether those impacts actually happen. And so that's where that system of following up, going out and looking at those systems, that's going to be, I think, the key, at least for VDH from a regulatory program, is once we permit a system in an area that we think may be impacted, going back out and making sure, that it hasn't gotten to that point where it is being impacted. So it would be great to get to hopefully where we permit the system and we go out in 15 years and what we think is going to happen hasn't happened, and the system's still functioning properly. But so it's all kind of gets into that trust and verify as we move forward.
Makes sense. Thank you. Let's see. Margaret Martin's had just a comment in terms of funding, that the Water Well Trust has funding for wells and septic, I think for individual property owners, and she included a link. So thank you for that. Always good to have additional funding sources. As you all mentioned, this stuff can be very expensive. So let's see. The last question we have in the Q&A to this point, it's just an area that might need some clarification. In a coastal area, it's one attendee's understanding that it's pretty impossible to get a discharge permit for treated effluent due to no phosphorus or nitrogen allocations. I'm not sure if you all could clarify that or speak to that a little bit.
So I think the bigger issue for most coastal areas, and so we deal with single family discharge systems. So we, anything that's over a single family would be permitted solely by DEQ. We do a joint permit with DEQ for the single family homes. And typically the issue with getting a discharge in a coastal area is shellfish water, because you cannot create a new discharge I'm sorry, a new closure. And by having a discharge, you would have a new closure because you have effluent being discharged there, even if it's treated. So that's typically my understanding, is the issue is not so much the how much can you treat it, it's that you're creating a new closure of shellfish waters.
Excellent, that's helpful, thank you. Let's see, I don't see anyone's hand up in the attendee list. Are there any other final questions? Feel free to raise your hand or throw one back into this Q&A box.
While we're waiting for people to ask questions, I'll just throw to Lance and to Carrie. So what are the next steps and plans for the wastewater infrastructure work group? Will they be reporting additionally to the General Assembly in the future? Any plans on that front?
So their wastewater infrastructure work group did have its annual report to the General Assembly last month. And I think probably one of the key things that group was formed initially, even before it was officially formed through the code. It was formed by Ann Jennings when she was the Deputy Secretary and then Secretary of Natural Resources. And the thought was this group was going to go out and help find funding. And then all of the funding just showed up all at once through ARPA. And so we have a lot of work that we're having to do with that. So, but it will help, having that group is certainly helpful looking at long-term, water solutions, because ARPA, as wonderful as it is, it's a one-time shot of funding. So we do still need that broader long-term funding availability. So we are working with DEQ on wastewater infrastructure needs assessments. And then I think another key thing that was talked about towards the end of last year with the infrastructure work group is outreach to K through 12. And how do we do some outreach there? So sharing things like Septic Smart Week, kids love talking about poop. So, how do we get that, in the classrooms and, get a better understanding of wastewater and get more people interested in that at a younger age.
So that's not a group that would be, for example, looking far out long-term at, well, the question was asking about a moment ago, the predicted sea level rise and increasing precipitation, increasing perhaps shellfish closures due to flooding of septic systems, long-term policies for the Commonwealth.
So long-term, so we do, VDH did receive funding from DCR, so pass-through funding to provide to VIMS. As soon as I can get our contract language finalized internally, I can share that with VIMS to expand that wastewater hotspot map beyond just the eastern part of the state and expand it out for the entire state, and also to have it updated. And part of that discussion has been, what are other things, obviously you have sea level rise impacts on the eastern part of the state, but, what are some potential climate impacts on the western part of the state that we would want to try and map or better understand. And I think once we have that fuller picture of a statewide impact, then that's really going to help us for those next steps, like long-term planning.
I would say I think the group is interested in that. I mean, I think that's part of the reason that we all get together to talk about it. But, we've got to have our hands around the problem first before we can figure out long-term solutions, unfortunately.
Right.
Absolutely.
Looking ahead long-term is muddy, I understand.
So we did have one additional question come in the Q&A box. In terms of escalating construction costs, have the rising cost of construction, has that affected the number of households you're able to assist?
Yes, it has. So when we initially got the ARPA funding, we were anticipating an estimated cost of about $15,000 per project. And that was kind of overall looking at well projects, conventional system, alternative systems. And where we ended up at, or where we're at right now, it's averaging about $21,500 per project. So that overall cost is impacting how many we can do. The alternative systems are all exceeding $40,000. Once you add in the cost beyond just the system, you've also got to do tree clearing, and there's other ancillary parts that you have to get done in order to get the system installed. So even like the conventional systems, like Carrie mentioned, the upfront cost of a conventional system might be $12,000, but then you've got $10,000 worth of tree clearing that has to get done to put it in, and we're trying not to place that burden on the owner either. So it's definitely reduced the number of projects that we thought we could do.
Makes sense. Yeah, that's quite an increase in costs.
Yeah. Inflation hasn't helped any of us, right? Including us. So is there another question maybe?
Yeah, another one just popped in. Let's see. I heard that design services for septic tank upgrades is ASO conditioned to 200% of poverty rate. Would it be beneficial if some typical design options for those owners who can update or upgrade their septic tanks themselves were provided regardless of poverty level? I could read that one again.
So it was about 5 years ago, we had a lot of legislation, 5 or 6 years ago, on transitioning services. So 20 years ago, the health department designed everything. And then there was a creation of a private sector to do design services because VDH was backlogged. We weren't able to process all the applications quickly. And over time, people started to use that private sector voluntarily to the point it was up to about 50% of designs were done by the private sector. And then 5 years ago, we had legislation to direct VDH to transition all of that work to the private sector, to the point where last year it was around 95% of all designs were done by the private sector. But as part of that legislation, there was created a hardship guideline that maintains VDH as a provider of last resort. So there is the income piece. There's also an assessment of, are there enough service providers in an area? So a lot of our far southwest localities, you can still get VDH services even if you're above 200%. And then there's other mechanisms where you can request those services if it's a hardship, even beyond the 200% poverty guideline. So there are mechanisms, but it's the 200% or below, it's like an automatic. So
that makes sense. That's great context. Thank you.
Great. All right. Well, thank you both. No more questions?
No more questions.
No more questions. All right. Well, thank you again, particularly during the legislative session, for taking the time when you're very busy. Jillian, did you want to announce something?
No, I just was going to inform all the attendees that there will be a follow-up email going out with presentation slide links and the link to the YouTube where the recording will be posted.
Thanks. And please keep an eye out for an email about our final lucky seventh webinar about funding for resilience efforts. And that should be a very interesting final webinar. And thank you to everyone for joining us today and for all these monthly webinars.
Thank you, everyone.
thank you for having us.
Thank you.
Well, appreciate it.